morning. So let's have a look at the liver. Okay, this is the diaphragmatic surface of the liver, and this is the inferior border of the liver. Okay, on the diaphragmatic surface of the liver, there's not many features that we can see, but the most prominent one here is this one. This is the falciform ligament, falciform ligament, and at the free border of the falciform ligament here, there is the ligamentum teres. There's the ligamentum teres here in the free border of the falciform ligament. Okay, up here you can see. Okay, this is the coronary ligament. Right coronary ligament, left coronary ligament. Okay, this is right anterior layer coronary ligament, left anterior layer coronary ligament. Left anterior layer coronary ligament ends as the left triangular ligament. Right anterior layer coronary ligament ends laterally as the right triangular ligament. Now let's have a look superiorly on the superior surface here. Okay, again I will repeat. Right anterior layer coronary ligament ends laterally as the right triangular ligament. Left anterior layer coronary ligament ends as the left triangular ligament. And here you will see left posterior layer coronary ligament, and this is left posterior layer coronary ligament. Okay, on the superior and extending a bit posteriorly, you'll see there's the bare area of the liver on the right lobe of liver. Okay, this is bare area of liver. Okay, this is bare area of liver. Its apex is the right triangular ligament, and its base here is the groove for inferior vena cava. So this is bare area of liver. Okay, now let's have a look at the visceral surface of the liver. Visceral surface of the liver. Okay, let's have a look at this ligament here. Okay, this is ligamentum teres. Okay, at the free border of the falciform ligament just now, and you'll find it in the fissure for the ligamentum teres. This is fissure for ligamentum teres. And here you can see fissure for ligamentum venosum. Inside the fissure for ligamentum venosum, you'll find the ligamentum venosum. And at the edges of the fissure for ligamentum venosum here, you can see there's the cut section of the hepatogastric ligament. Here the hepatogastric ligament at the edges of the fissure for ligamentum venosum. Inside the fissure for ligamentum venosum, you can see the ligamentum venosum itself. Okay, here is the porta hepatis. Porta hepatis, and you can see that is encircled by a ligament, and that is the hepatoduodenal ligament. Hepatoduodenal ligament. In the porta hepatis, here, in the porta hepatis, you can see here there are three main structures. Okay, posteriorly, blue structure here, hepatic portal vein, and in the middle here, there's the hepatic artery, and most anteriorly here is the hepatic duct. Okay, here you can see a gallbladder. Here you can see gallbladder, and you can see this is the cystic duct. Cystic duct, and the cystic duct here merges with the hepatic duct to form the the cystic duct merges with the common hepatic duct to form the bile duct. So the fissure for ligamentum teres. Let's have a look at the visceral surface of the liver again. Visceral surface of the liver. Fissure for the ligamentum teres and fissure for the ligamentum venosum is known as the left sagittal fissure. Fossa for gallbladder. Fossa for gallbladder and groove for inferior vena cava forms the right sagittal fissure. And right sagittal fissure and left sagittal fissure is connected by porta hepatis, thus forming letter H. Left sagittal fissure divides the liver into two anatomical lobes. Firstly, right anatomical lobe, and then the smaller left anatomical lobe. The right sagittal fissure that corresponds to the Cantley line on the diaphragmatic surface. Here, right sagittal fissure, it divides the liver into two functional lobes. The left functional lobe larger and the smaller right functional lobe. Here we can see this is the caudate lobe. It has a caudate process here and papillary process here, and this is the quadrate lobe. This is the quadrate lobe. Again, let's focus on the visceral surface of the liver. Let's have a look at the visceral impression. Visceral impression, this is the esophageal area. This is the gastric area. This is the duodenal area. Down here should be the colic area. Up here should be the renal area. And above that should be the suprarenal area. Thank you. So that's all for liver.